Veterinary Internal Medicine. The Etiology, Pathophysiology and Diagnosis of Renal Failure in Dogs. The following lecture is presented by Dr. Masna Ali Muhammad from the University of Veterinary and Animal Sciences in Lahore, Pakistan. Dr. Muhammad is one of the veterinary students sponsored by the Veterinary channel.
Welcome to Vet Things channel. Today I am going to give a lecture on diseases of kidneys in dogs. In this chapter we will focus on renal failures in the dogs. First of all, let us try to understand the anatomy of kidneys in the dog. Here is a picture of kidneys in the body of the dog. It's the right kidney and it is the left kidney. You can see that the right kidney, which is somewhat fixed, is located under the sublumbar muscle at the level of first, second and third vertebrae. The left kidney, which is attached to the peritoneum, lies on the symmetrical position of the right kidney when the stomach is empty, but it may go backward up to the level of third, fourth or fifth lumbar vertebrae when it is full. Now let us try to understand what is the function of the kidney. The function of the kidney depends on the following things. Number one, the blood pressure or the adequate perfusion of the blood in the renal artery, which is a branch of aorta. Number two, the efficiency of the healthy renal tissue, which reflect the adequacy of the nephron unit for filtration. Number three, the adequacy of the renal system to permit adequate free flow of urine posterior to the kidney. And the process of urine formation passes through two main stages: the formation of diluted urine and the formation of concentrated urine. Now, what is renal failure? Renal failure is a term applied to describe a case of disease affection that results in the loss of at least 75% of its kidney's functioning tissue. Following are the types of the renal failure. Renal failure could be classified according to the situation of the cause into pre-renal failure, primary renal failure and post-renal failure. What is pre-renal failure? This condition is usually due to some affection that result in an adequate blood pressure in the renal artery, as in case of shock, dehydration and some cardiac diseases. What is primary renal failure? This condition is due to affection of kidney tissue either by inflammatory process, infection, neoplasm or calculi. Now, what is post-renal failure? This condition is due to inadequate flow of the concentrated urine in the urinary tract, as in case of obstruction or rupture of the bladder and or urethra. Acute and chronic renal failure. Renal failure may be acute or chronic. Both acute and chronic renal failure was terminated in uremia, i.e. it it leads to uremia. What is acute renal failure? Acute renal failure, although very dangerous, is curable, while chronic renal failure is very dangerous and incurable. Acute renal failure. According to the definition, it is an acute suppression of the renal function caused by sudden disruption of the functions of all nephrons with no time for compensatory mechanism. It is sudden and of short time. But acute renal failure differs from the chronic renal failure, in which there is a gradual death of the nephrons. In case of acute renal failure, it was sudden disruption of the functions of all nephrons, but in case of chronic renal failure, there is a gradual death of nephron with the remaining nephrons functioning in a normal or supranormal capacity. Some part of the kidneys of the nephrons is damaged, but most part of the kidney may remain functionally healthy. Acute renal failure is potentially reversible, whereas chronic renal failure is a progressive and irreversible condition. What are the possible causes of acute renal failure? The etiology of acute renal failure include ischemic injury, hypovolemia, or chemical insults, i.e. toxins or drugs. Hyperkalemia, it's uncommon, but it is one of the etiological cause. And infections. Infection may be bacterial, which includes pyelonephritis, leptospirosis, or bacterial kidney infection, and the glomerular diseases could also be the cause of acute renal failure. This diagram explains us the possible causes of the renal failure. Here, the number one is the hypoperfusion of the renal failure. In the diagram, the labeled 1 explains us the cause of renal failure could be the hypoperfusion. The level 2, which is indicating the narrowing of the path of the vessels, which is the vasoconstriction. It could also be the cause of renal failure. And the labeling number 3, it tells us about the glomerular nephritis. If your dog confronts with glomerulonephritis, it could also cause renal failure. And here you can see there is a blockage of the pathway. It is actually the tubular necrosis. Necrosis is the damaging of the tissues. And the number 5, here you can see that could be the cause of renal failure is interstitial nephritis. Such nephritis, such inflammation of nephron that could be caused by interstitium of the kidney. And here is number 6, the somehow bigger balls. They are showing us edema. This edema could be due to interstitium of the kidney. So interstitial edema could also be the cause of renal failure. And here number 7, you can see that a vessel is coming and suddenly the path of the vessel is blocked. So outflow obstruction could also be the cause of the renal failure. Now, what is the pathogenesis of the renal failure? There are four major mechanisms that are involved in the initiation and maintenance of reduced glomerular filtration rate and reduced urine output. Number one, reduced renal blood flow or renal artery vasoconstriction. It could be due to thrombus in the renal artery that could cause vasoconstriction, or that could cause blockade of the blood flow through the renal arteries. Number second is the intratubular obstruction. Intratubular, as the name indicates, there could be destruction by some foreign materials such as drugs, such as sulfonamides, can precipitate in the lumen of the tubules and thus causing the obstruction. And number third is the back leak. Back leak is the reabsorption of the urine to the blood due to damaged tubular epithelium. It could also cause the pathogenesis. And the number fourth is the decreased glomerular permeability. Now, what is the clinical picture? The clinical course of acute renal failure proceeds through a sequence of overlapping phases. Number one, initiation phase. During this phase, there is decreased urine output and increased BUN, blood urine nitrogen and creatinine level. And number second is the oligouric phase. During this phase, majority, about 80 to 90% of the acute renal failure dogs and cats become oligouric. Increased urea and creatinine with hyperkalemia occurs in this case. This is very dangerous and could be fatal and can take the life of your pet, dogs or cat. Number third is the polyuric phase. The polyuric phase may indicate the beginning of renal repair and return of function, or may be inactive of a less severe insults to the kidney. In this phase, somehow the disease goes to the recovery phase. But in this case, there is a loss of nitrogen and water also. Number 4 is the phase of functional recovery. As the name indicates, there is the repairing to the renal injury. Blood urea nitrogen, creatinine and urine volume gradually returns to the normal. Some acute renal failure may progress to chronic renal failure, worsening the condition instead of making it progressive to the healthy condition. Now, as far as lab diagnosis is concerned, we go for increased total protein, and PCV is seen due to hemoconcentration. Number 2, we see thrombocytopathy, that is due to the retention of the waste products NPN, non-nitrogen protein waste, which make the platelets less agreeable, i.e. less sticky. Number 3 is the uremia, that interferes with the function of white blood cells, which may predispose, means that may enhance the acute renal failure patients to the infection. And fourth is the hyperkalemia, that is associated with the ECG abnormalities. There are several causes of polyurea. Number one is the impaired tubular sodium reabsorption causing loss of sodium in the urine. Number two could be the excretion of the solutes retained in the oliguric phase, i.e. small molecules like urea are osmotically active. Number third is the impaired response of tubular cells to ADH, nephrogenic diabetes insipidus. We go for radiography. Kidneys are normal to large in patients with acute renal failure as compared to small kidneys than the normal in chronic renal failure. In acute renal failure, the kidney's size may be normal or it may be larger than the normal. But in case of chronic renal failure, the size of the kidney is usually smaller to the normal size. Now, what is the treatment of the renal failure? Number one possibility is the immediate care. The immediate care includes identifying, if possible, and eliminating the itching cause, and then we go for the correction of fluid deficits, i.e. we correct dehydration to rehydration to re-establish the adequate renal perfusion, and we give diuretics. Diuretics may be administered after fluid replacement when urine production is inadequate. Furosemide is given and hypertonic dextrose is administered. The dosage is written. You can follow this dosage for the treatment of renal failure. The second possibility is the maintenance treatment. In this, diet should be comprised of high caloric density fats, carbohydrates, and small amount of high biologic value proteins, and sodium and potassium injections in case of polyuric phase should be administered. Now, what is the treatment of hyperkalemia? In case of hyperkalemia, we give sodium bicarbonate 0.5 to 1 as per body weight. Number second is the sodium bicarbonate combined with hydrogen ions in ECF. This creates a gradient for additional hydrogen ions to move out of the cells into the ECF, extracellular fluid. As hydrogen ions move out of the cells, potassium ions move into the cell. That helps in correcting the hyperkalemia. What are the post-test? What should we know about the post-test of our case? We should know about what are the differences between the acute and chronic failure. We should know about how to describe the lab findings of a dog with acute renal failure. We should be able to tell why should dogs with renal failure receive low protein diet, and we should be able to tell what is the importance of hypertonic fluid therapy in a renal failure patient. Thank you. This is all. You can ask questions in the comments box. Your questions will be highly encouraged. Please subscribe to our channel to have more videos like that and click the bell icon. Thank you.
Veterinary Internal Medicine. The etiology, pathophysiology and diagnosis of renal failure in dogs.